Are you the parent of an infant or adolescent or even a young child struggling with sleep and wondering what are ways that you can naturally optimize their sleep potentially? In today's episode, we're going to talk all about the role of DHA and how it may help improve sleep outcomes in our children. For those of you who are new to the show, my name is Dr. Blair Rolnick. I'm a pediatrician and mom myself.
Welcome to the Beehive Doc Talks with Dr. Blair Rolnick. As a pediatrician and mother herself, Dr. Rolnick is here to answer your most pressing parenting questions and guide you through the tough spots.
Deficiencies in long-chain fatty acids, such as omega-3s, have been associated with poorer behavioral and cognitive outcomes. And so it's kind of a natural area of research in pediatric sleep, since we know that sleep has such a huge effect on children's behavior and brain development. Let's dive right into some of the emerging research. There was a recent randomized controlled trial, which is one of the highest standards or studies that we can look at, out of the UK, that looked into whether fatty acids play a role in sleep regulation. They particularly were looking at children ages 7 to 9. In this study, they supplemented half the children for 16 weeks with 600 milligrams of algal DHA, which is also quite interesting to me that they chose in this study to use a plant-based source of DHA, because we've been talking a lot on this platform about some of the potential benefits of more plant-forward diets. So I thought that was kind of an interesting choice. But they looked at, again, children aged 7 to 9 and just cut them in half and gave half of them this algae-based DHA supplement. And they were specifically looking at their sleep habits after 16 weeks of supplementation. Interestingly, they did identify a subgroup in this study who were underperforming in reading, and as part of the study, did measure serum DHA levels and found that they had lower serum DHA levels. Right off the bat, about 40% of these children had a clinical sleep disorder based off the sleep questionnaire that they performed. So about half the kids randomized into both groups had a sleep disorder based off of the clinical history. Children with lower serum levels of DHA had poorer sleep scores off of the bat. At the end of the study, they did not find a statistically significant difference between the placebo and the treatment group on the sleep questionnaires. However, what they did note is that children in the treatment group had 7 fewer night wakenings a night on average and about 48 minutes more of sleep a night. And while that didn't correlate to a statistically significant difference, I think that is a clinically significant difference. I know for myself, my son waking up 7 less times a night or getting an hour more sleep a night would make a difference to my overall happiness as a parent. And so I think even though this wasn't statistically significant, it's probably clinically significant and significant enough for parents where we should kind of be aware of the potential role of DHA supplementation, particularly in children who are either underperforming in reading or already have a baseline sleep disturbance. Additional studies, particularly studies out of South America, have shown that adolescents who have higher plasma levels of DHA sleep longer. So on average, children or adolescents with higher levels of DHA sleep about 32 minutes more than those who do not, and go to sleep earlier. So again, kind of an interesting population-based observational data. Kind of taking a deeper dive into more data, there was also a study published in Pediatrics in 2019, which looked at the role of DHA and AA supplementation on sleep in toddlers who were born preterm. So we know sometimes that preterm babies have a harder time with sleep architecture and organization. There's a lot of interesting and emerging research going on in infant and newborn sleep, and seeing if that is somehow a predictor for neurocognitive outcomes. So what they're kind of finding is babies who sleep better right off the bat, talking about days 1 and 2 of life, have better neurocognitive outcomes 5 and 6 years out. So this was looking at, again, those preterm babies, those toddlers who were born preterm. Does supplementing DHA and HA have any effect on their sleep? This was also a double-blinded, which makes it, again, statistically a better study, randomized controlled trial. They included children who were 10 to 16 months old and who were born before 35 weeks gestation. They had around 350 to 400 kids total in the study, and they gave those children 10 to 16 months, 200 milligrams of DHA and 200 milligrams of AA for 180 days. And what they found was that the children who were in the treatment group had greater improvements in their sleep and their sleep architecture than those in the placebo group. Again, a small study, but when you look at the multitude of studies, it makes an argument for the potential role or using DHA as a potential tool to help improve sleep in our children. So this kind of really led me to the question, when does DHA supplementation or consumption really start to matter? Does it matter when your child is a toddler? Does it help when they're an infant, a newborn, an adolescent? Like, when should parents be thinking about supplementing DHA in their children or focusing on a natural source of DHA in their diet, not necessarily a supplement? DHA supplementation has actually been shown to benefit even newborn and infant sleep when taken prenatally. So this suggests that DHA or prenatal DHA consumed by mom or pregnant mothers has a potential role in infant sleep. We recommend that pregnant moms take DHA supplements for other reasons, such as vision and cognitive and behavioral outcomes. But this might be one more reason to be counseling our pregnant moms to think about the amount of DHA that they're getting in their diet. So this study that I'm talking about was published in 2012, although there are others, again, a double-blind randomized control trial. And they looked at newborn sleep and maternal DHA. So they took moms, a group of moms, again, half of them, they had take DHA, 300 milligrams, at least 5 days a week, because everybody forgets to take their prenatal once in a while, starting at 24 weeks gestation up until delivery. And then they had a group of moms take a placebo. And what they found were the babies who were in the treatment group, so the moms who took DHA, their babies had less arousals in their sleep compared to the placebo group. And so again, this kind of potentially makes a suggestion or argument for an additional role for DHA in the prenatal and maternal diet. If you're wondering about what else you can consider in the maternal diet and more of the role of DHA in the maternal diet, you can check out our full episode on maternal diets, highlighting the role of DHA. Overall, again, I hope you find these episodes to be helpful and empowering. Certainly any parents who are out there going through sleep disturbances with their children, here for you, that's a really difficult time. If you have a child who was having a sleep problem and you did supplement with DHA, I'd love to hear your feedback on how that went for your family. Please leave a comment below.
Thank you for watching the Beehive Doc Talks with Dr. Blair Rolnick. For more episodes and her practice, visit BeKindPediatrics.com and don't forget to subscribe for more parenting tips wherever you get your podcasts. This information is for educational purposes only. It is not medical advice. Always seek medical advice from a qualified physician.